I want to stress that no menstrual health dysfunction is normal in athletes, and it could never be considered that way. Sometimes it's seen as a boasting way to say that they're adapting or they're doing high intensity or high volume training, but it should always be seen as a negative health impact of training. Oligomenorrhea is when cycles are prolonged, so greater than 35 days. A normal cycle is somewhere between 25 to 35. Primary amenorrhea is when a female hasn't had their first period or menarche, and this is deemed after the age of 15. Secondary amenorrhea is when there's a loss of 3 consecutive cycles. And we'll come back to why that differentiation between menstrual cycle dysfunction is important when we're risk stratifying for REDS signs and symptoms. I want to stress, though, that amenorrhea and oligomenorrhea is a late sign of REDS. So if you are seeing this in your athlete, this means they're well and truly already down that REDS syndrome and they need prompt referral and assessment. In male athletes, we look at lowered testosterone, early morning testosterone, as another potential marker of REDS, as well as low libido and loss or decrease of early morning erection. And we will talk specifically about male athletes next. We look at blood markers of physiological impairment, such as suppressed thyroid function. Looking at elevated lipids, suggest mobilization of other energy means, as well as bone stress injury, which most of you would be well aware is a potential sign of REDS. And I would stress that any bone stress injury should be treated with the lens of a potential REDS diagnosis and a clinical assessment made with that in mind. Impaired growth and development in children is a really important one to flag a potential diagnosis of REDS. And then we have gastrointestinal and genital urinary impacts, such as urinary incontinence, altered bowel habits, whether that's diarrhea or constipation, as well as liver dysfunction. In the more severe end, we might see impaired cardiovascular function, and that might be seen by dropping one's blood pressure, whether statically or posturally, as well as syncope or fainting. Other softer markers are iron deficiency in our athletes, as well as recurrent injury, which may be something that's picked up in the physiotherapy world, and recurrent illness is a potential another marker. Moving to male athletes, I just wanted to highlight that the effects of problematic low energy availability in REDS is less understood in males. It's less researched, but there's also evidence to suggest that males can sustain a lower energy availability for a more prolonged period of time before biological processes are disrupted. It's hypothesised that males can get down to 9 to 25 kilocal per kilo compared to 30 in females, so it's a significant a lower threshold. The two emerging potential indicators of REDS in males that have been highlighted in the latest consensus paper are low libido and decreased morning erection. So while they can be sensitive things to ask your athletes and your patients, they may be a vital sign in male athletes when we're talking about REDS. If we move to psychological impacts, we need to be mindful that psychological impacts can both be the result and the cause of REDS. So they're very interconnected and we need to keep that in mind. So obviously disordered eating or an eating disorder, impaired cognitive function, changes in mood such as depression or irritability, general reduced motivation to train or compete, as well as sleep disturbance should all be triggers to start thinking about whether this athlete could be in REDS. And lastly, the performance indicators. And this again was introduced as the REDS performance model by the consensus group. And there could be impact on any elements of performance. It could be overall, it could be individual areas like endurance, strength, power. It might be an inability of an athlete to adapt to training, and there may be impact to their cognitive or skill ability. Importantly, if you're seeing significant impacts to training availability or match availability, that should flag as well for further assessment. So screening and diagnosis of REDS is actually quite challenging because symptoms can be subtle, but you can also see they're incredibly varied, and there's a large list of potential differential diagnoses that need to be excluded.